1995, I started collecting data, lab data, chemistry data on blood, urine, and tissues. And at this point, this is what my database consists of more than 10,000 individuals with behavior and ADHD problems, including more than 800 who were felons who had been in prison. And I've also got a fair share of people who were mass murderers and serial killers. I've got a lot of data. And also, but most of these are children. Most of these are children lower than the age of 16. I've got data, a large amount of database for more than 6,600 autism spectrum disorders, 3,500 schizophrenics and bipolar, and more than 3,000 depressives. Well, that's a huge amount of data. And for most of those, I have between 90 and 100 separate chemical analyses. And when you total it up, we have more than 2.5 million chemical test results. That is a gigantic amount of information. And of course, these are for people who have depression, bipolar disorder, et cetera, people with a diagnosis. And of course, the natural thing is to compare that with the general population to see whether there are differences. And there are. The bottom line of this is that there are major biochemical differences between these mental illness populations and the rest of society. Now, one thing that perplexed me in the beginning was I kept seeing across the various disorders some of the same imbalances coming up. For example, zinc deficiency. Zinc deficiency is present in more than 90% of the people with these mental illness problems, even though they're so completely different. Copper overload is present in many completely different disorders: undermethylation, folate deficiency, pyrrole disorder, toxic metal overload, and oxidative stress. So I call them the repeat offenders. And for example, elevated copper, that's found in paranoid schizophrenia, ADHD, more than 90% of people with autism, and more than 95% of people with postpartum depression. So you have to ask why. I mean, these disorders are so completely different. Well, after a few years, it finally dawned on me that every one of these conditions, every one of these commonly found imbalances had one thing in common, and that is they are each directly involved in the synthesis of neurotransmitters.